I'm going to write things up, but I wanted to submit it in a video form just because I learn better by doing and practicing. So let's start. I'm Nurse Jenny. I'm walking down the hall. Hi, this is Jenny. I'm going to be your nurse today. I'm going to be taking a look at your drain and your incision and just making sure everything's okay, all right? Okay, that's great. Excellent. I'm going to go ahead and, because those dogs are barking, shut the curtain so you have some privacy. Because who wants dogs barking? All right, do you mind just verifying your full name and your date of birth for me?
Oh, yes. I'm Samuel Davis. I was born in April 17th, 1973.
Excellent, Samuel. It says right here on your wristband that I am obviously checking on myself. That is correct, but I'm not saying that out loud. I'm thinking it. All right, so I've come in, I've introduced myself, I've shut the curtain. I'm gonna use some hand hygiene. I'm going to just pull back the covers, take a look, not touching anything yet because I need my gloves to do that. Gloves on. Excellent. So I'm just sort of looking. I'm going to kind of palpitate. And then I'm looking all the way down, just checking the area for inflammation, extra drainage. So I've seen Samuel before and I know that he doesn't have a lot of drainage. So I'm seeing that today and that's normal for him. So that's good. So I'm looking down. I don't see any kinks in the tubing. I don't see any holes or anything like that. I'm just looking at the little tubing mechanism because I need to understand how many drains it has and what type it is. So I'm looking at it. Okay, excellent. It's got a, drain out here. And we've got some fluid. So I'm going to get a chuck pad, kind of lay it underneath, tuck it. And then I've got my receptacle that I'm getting because I've got to put it over there. I have alcohol pads at the ready because you always need those. And so I'm going to go ahead, and now that I'm done examining, I'm going to go ahead and just open up, holding it away from my face, holding it away from Samuel's face. And then I'm going to pour it into my container. So I'm holding it like this and pouring it down the backside. I don't want any splashes or anything. I'm observing the fluid, the color, the smell, as maybe it's unpleasant, maybe it's not. All right, it looks normal. It's about 70 milliliters, which is good. It's a incremental decrease for Samuel since the last time I saw it. So I'm gonna go ahead and put that down someplace safe, secure. Now, before I put the cap back on, I'm going to go ahead and get one of those alcohol pads. I'm going to rub it, make sure I've got it all cleaned off, and then I'm going to compress it to make sure I'm maintaining pressure, and I'm going to recap it. Now, once I've recapped it, I'm going to just go ahead and set it down next to him on the bed, tape it down if I need to, or readjust things. Now I'm going to go ahead and cover him back up. Chemo. Well, take my gloves off. Right? Gloves off. Cover him up. Are you good? Do you need anything right now?
Oh, I'm doing great. Okay, thanks for doing that.
No problem, Samuel. Well, where's your call device if you need me? Okay, it's right there. Great. So I can see that your call device is close by. Do you need to get anything else while you're here?
No, thank you so much.
Okay, great. So then I'm going to dispose of the liquid. And then immediately after that, beam up. And then immediately after that, I'm going to document. So any sort of patient teaching I did, I want to make sure I document how much fluid came out of that, what it looked like, what it smelled like, what the color was, if there was a strange consistency. But everything was pretty normal for him and what I would expect. And he's not symptomatic or complaining of pain. So that's a good thing. I'm right on track.